Welcome to Nursing 203, Week 7, Chapter 81, Day 4,000 of the COVID catastrophe. Cardiovascular, and apparently cats in the background. And yes, that is a zombie drinking wine up on top there, just in case you were wondering. Time for cardiovascular, my favorite subject. I really wish we could go into this more and more in depth, but we could go down the rabbit hole for weeks and still not hit bottom. So let's have some fun. And I'm going to be playing with whiteboard this time just to see if I can make it work. So everybody get caffeinated. Let's get ready to do this. Come on. Cardiovascular disorders. On the surface, really, really, really complex systems, but very simple in their complexity. What do you mean, simple in their complexity? Yeah, this guy's totally caffeinated, right? He's bug nuts. No, the heart in itself, the heart and the blood vessels, the heart in itself is a pump. It's actually two pumps that work side by side to fulfill the body's metabolic needs. Vascular system, that's plumbing. Again, we can take back to the analogy, your body is like a temple or a tar paper shack. This is the plumbing. So, cardiovascular or CV disorders, right, interferes with the heart's ability to pump because really, quite honestly, your heart has one job: to pump blood efficiently and effectively, to perfuse the organs, and to meet your body's metabolic demands. So cardiovascular disorders may interfere with that heart's ability to do so, may disrupt blood flow within the coronary or cerebral vessels. Okay, coronary, heart, cerebral, head. Okay, or disrupt blood flow to a localized area. Cardiac nurses, as you may already be aware, are sort of a strange breed. Places that we may work in progressive care units, intermediate care units, coronary care, or ICU, or teaching in a nursing program. Some of the lab tests that we're going to be looking at, and you want to dig these up in your book and become really familiar with them. Virtual foot stomp there. The creatine kinase, or CKs, the isoenzymes, which again we're referring to the CKs, but the isoenzymes are in particular the CKMB, myocardial band. The CK is released when there is muscle damage. So elevated CKs or CPKs, the creatinine phosphokinase, can be released when muscles are stressed or damaged. So CKs in themselves are a pretty broad, not really indicative of what's being damaged. CKMB, or the myocardial band, as you've learned in bio, cardiac muscle is similar yet a little bit different to skeletal muscle. The CKMB is more specific to cardiac muscle damage. Okay? LDH, lactic dehydrogenase, ASTs, troponins, one of our gold standards really, and myoglobin. Troponins, you'll find two types in places that you work. There's the troponin I and the troponin T. Depends on where you work, which ones they're using, but the troponin T is a much more sensitive test. You may have a troponin I of 1.0, and that's indicating that there's some damage going on. But if you had a troponin T of 1.0, that's all hands on deck. Bubba's trying to die. Okay. Lipid studies, huh? What's that got to do with the heart? Ever hear of a silly thing called cholesterol? Elevated blood lipids can indicate risks for or create risks for heart disease and vascular disease. These lipids can be laid down in fatty plaques. These cholesterols laid down in fatty plaques in the arteries, which can reduce the size of the artery and impair blood flow or stop blood flow, which then everything downstream or distal to the occlusion is now being starved for oxygen and glucose and everything else in the bloodstream that those tissues need. Plus, they're not getting the waste taken away. Leads to tissue damage and tissue death distal to the blockage. So for cardiovascular, well, what's the big deal? We'll talk here about. There are 3 separate circulations that we're dealing with in the human body. We kind of touched on this in earlier on in the term when we were talking about the circulatory system. Right? 3 separate systems. You have the systemic circulation, the pulmonary circulation, but yet a third distinct piece of this is the coronary circulation. The heart is a muscle. It's a very important muscle. You really can't get by without it. It's also a very greedy muscle. In fact, it drinks from the source. The coronary circulation takes off at the base of the aorta, that large vessel coming off the top of the left ventricle, and feeds the muscle of the heart, feeds the myocardium, and then the venous return comes around back to the coronary sinus at the base of the right atrium to be circulated, that blood to be circulated back through the lungs. It's so important it has its own specialized circulatory system, because if your heart stops because the muscle is dying, we have a clinical term for that. It's called dead. You can't get by without your heart, unless you have a mechanical heart or a worm. Oh no, they have several hearts. Never mind. But yeah, so you really can't get by without it. Serum electrolytes. There's been a running joke around here with graduates. They know their potassium. Potassium is very, very, very important for muscle contraction, cardiac muscle contraction especially. If sodium is too high if the potassium is too high or too low, then you have different dysrhythmias that can occur with this. Potassium in and of itself, if the potassium gets too high, bye-bye Bob, because the heart muscle, recall what we just covered in electrolytes and the charges, muscles, just covered, I should say, last week, week 6, crazy, right? That muscles require these electrolytes to contract, and they bind together with opposite charges. They flip in pumps, so you have to have these electrolytes. Potassium and sodium are both positive, right? They're both cats. But potassium is so very important for cardiac muscle function. Sodium, of course, you may have heard this maybe once or twice before, but if you haven't or weren't paying attention, water follows salt. All right. Sodium and chlorine together makes table salt. It's not happening in your body like that, but sodium, salt. Water is keeps sodium in suspension or in solution. Right? We get rid of excess water by kicking sodium out in the kidneys, and the water follows it out into the tubules, and then it's gotten rid of. Right? What's that called? Micturition, right? That's the act of urinating, or urine production, right? Or elimination. And then magnesium, also very important in maintaining the function of the heart. Magnesium gets too low, and the heart can go into all sorts of crazy rhythms. Oh, I wish we had more time. This is really the fun stuff, guys. It is. As a ticker, and just reminding you, Shadow Health. Don't forget that piece. But the Cardiovascular Concept Lab in Shadow Health has some great animations as to the cardiac cycle. Fun stuff. So, radiography, X-ray, or radiographic imaging, right? An angiogram. Now, we talked in first term about a surgery is a surgery is a surgery, and an angio is an angio is an angio. The difference is location, right? So, an angiocardiogram, aka angiogram, is a picture of the vasculature of the heart. An arteriogram, specifically the arteries, right? And that can be, we could be doing an arteriogram of the legs, of the abdomen, of the wherever, right? But these are tests that use radiopaque dyes, meaning it shows up on X-ray or on fluoroscopy, on imaging. So an angio is an angio is an angio. Number one, allergies. Shellfish or iodine, now you've got a problem, right? If they have an allergy, because the radiopaque dyes contain iodine. Severe anaphylactic reaction. Well, okay, we'll give them some Benadryl and some epi, and they'll be fine. If you're looking at the heart, one, you don't want to throw the respiratory and circulatory collapse on top of that, and two, the treatment epinephrine on a stressed heart can increase further damage. You start thinking about these different pieces as you are looking at treatments and what's going to happen. Epinephrine, right? That's your fight or flight hormone. Causes blood pressure to rise, causes the heart rate to rise. On a stressed heart, or on a heart that has severely or even somewhat compromised vasculature, you're going to increase the stresses and increase the damage done. This is also something to think about for your patients who have allergies. Is the cure going to kill them? Right? If they have those severe allergies and they also have cardiovascular disease. And also, as you're covering these medications in pharmacology, I want you to think about beta blockers and what they do. And here's one to show your mastery to Miss Tyra. Tell her why. Say, Sean said that we need to tell you why patients with asthma who are on beta blockers, or with anaphylactic reactions who are on beta blockers, run a higher risk of death. And if you think you got the answer, go ahead and drop one in the comments. Although I haven't been getting my notifications lately, but I'll look. Okay, so in which the femoral site is used. So your basic angiogram, also sometimes referred to as a roto-rooter. We'll get to that one. So femoral site may be used, or the radial artery. Radial artery has its own set of complications because the catheter is going in, well, through the radial artery, and there is a potential for nerve damage. So a lot of practitioners go in through the femoral artery. For your final exam, you really want to know the vasculature forwards and backwards from the heart to the femoral artery. And we'll play with that in a little bit. They say here, client should lie flat for up to 8 hours, depending on the procedure, but it can be up to 8 hours lying flat. No raising the head, no straining. If you got a cough, laugh, or sneeze, you're teaching the patient to reach down and hold on or put pressure over that site at the femoral artery where that catheter has been, or the sheath has been put in, so that they can go in and fix the heart. We'll get to that in a minute because this is a really cool procedure. But it is a big pipe. There's a lot of pressure. The heart's beating. It's keeping up that blood pressure because they've just gone in and fixed fixed whatever it was that was causing the chest pain. And now the heart's beating fine, and it's great cardiac output, and the pressures are all good. And you've just crammed a big sheath in through the side of the femoral artery, done the roto-rooter, pulled it on out, and now you've got the beginnings of healing happening in this, up to 8 hours piece. Right? You got the beginnings of healing happening. Body is starting to form scar tissue and close that hole completely. And it's really easy to pop that back open, and then you've got, you've got a lot of pressure going. Let's take back to the house analogy here a little bit. So your heart, got this pump, got the atria and the ventricles, and they're doing their thing. Ooh, that's kind of mesmerizing on my screen. They're doing their thing, they're doing their pumping, and right off the top of the heart comes the aorta, the highest blood pressure in the body, because it's right there at the pump. It's squeezing that blood out, just going to town. Think of the aorta as it comes, the ascending aorta, the aortic arch, and the descending aorta, right? The thoracic aorta, the abdominal aorta coming down. They're all parts, they're regions of the same pipe. Anybody ever seen a water main blow? In the street, city water main, all that pressure, all that water flowing out there. That's kind of like your water main in the city. And then, or, coming into your neighborhood. And then splitting out from that. So we've got let's see, we need a heart t-shirt. I really do. So heart sitting just about like so. Up in here, right? My aorta comes out the top, arches down, comes, okay, you can't see it now, but comes down, and then its first bifurcation is the common iliac artery. The iliac split off into the internal and external iliac arteries. For our purposes right now, we don't really care about the internal iliac arteries. All those do is just feed the organs and all that in the pelvis. Yeah, needs those. But then as they exit the pelvis, a magical thing happens. The external iliac artery becomes the femoral artery. Okay, so we got huge amount of pressure right here, and then it comes down and it's splits out, we still got a lot of pressure. And then we're poking a hole in that. So a patient can do a fair amount of bleeding from that little, well, we would think it's a little hole, but for an artery, it's a dirty big hole in the artery. A patient can do a fair amount of bleeding from that fairly fast. And then we have to go through some pretty crazy things to not only get the bleeding stopped, but to get the big hematoma to go away so that they don't have to go in and have surgery and have a great big blood clot removed. Yeah, and you thought this was going to be easy, right? Just fun. Although some of the most awkward conversations I have had while standing with my hand in someone's crotch for 20 minutes holding pressure, a stranger's crotch, holding pressure on their femoral artery to keep them from bleeding out. You develop your small talk skills. Not that it's awkward or anything. So other diagnostics. Electrocardiogram. We have electrocardiogram and echocardiogram, right? Two very useful tests. Show completely different things, right? An electrocardiogram. So electrical activity, right? Cardio, heart, gram, picture. It's a picture of the electrical activity of the heart. All right, easy enough. We see it's a nice square 12 lead that's showing all these different pictures and got all these funny little waveforms on there. And you get to sit and pick through those and say, ooh, that's right. Oh, that's good. Oh, that's not so good. All right, electrocardiogram just shows electrical activity. What do you think? Can a patient have electrical activity without a pulse? Yes, they can. Oddly enough, it's called PEA, or pulseless electrical activity. The heart muscle is depolarizing. It should contract. Something has happened. It's not contracting. So the electrocardiogram just shows you the electrical activity. There's a lot you can learn from that. The echocardiogram doesn't tell you a thing about the electrical activity, but it shows in real time through ultrasound, right? Echo, ultrasound. You can see the wall movement and the valve closures. And then when you put the two together, synced up, then you can see, oh, okay, we have electrical activity, we have wall motion, and we have the valves opening and closing. Looks good, or looks terrifying, depending. Hopefully it looks good, right? We don't go into this to watch people crash all day. If we do, then we should maybe be thinking about a different career field. Just saying. We want people to be better. Stress tests. So hooked up to the EKG, there is a stress echo, which is a little trickier to do, but stress test. Heart is put under stress, either through physical activity. You may have seen the person running on the treadmill with all the wires hooked up to them, as the doc's sitting there going, looking to see, does the electrical activity change when the heart is under stress? Okay, so when heart muscle is starved for oxygenated blood, say you've got a vessel that is nearly occluded or greatly restricted, when it becomes starved, and these so remember C6H12O6 plus 6O2 equals 6H2O6CO2 energy heat, right? Cellular respiration. Heart needs that. If it gets starved for that, then it does what every other cell does. and changes metabolism, which then leads to the buildup of acids. Okay, which then causes what do you think? Pain? Yeah. Ah, son of a gun. Let me pause that here real quick. Sorry about that. I've broken my own rule by having my ringer on. Let's go back to all right. Where did we go? All right. Hold on. Yeah. Where were we before the telemarketer rudely interrupted there? Sorry, guys. It's just been that kind of a day. Yeah. So acid builds up. You get chest pain. Right? Chest pain. You shouldn't have chest pain. Okay. Chest pain is a bad sign. Now there are some things that can mimic that, which is why we don't say, just heartburn, right? It's just heartburn. And before this happens again, let me shut this puppy up. Okay, hang tight here. Okay, let's try this again. All right, current slide. So, electro versus echocardiogram. Oh, fiddly poo. There we go. Electro versus echo. It's been a long day, guys. The electrical picture versus the actual movement. Nuclear scans, electrophysiology study, where we're actually tracing the electrical paths, and they're tracing those pathways so that we can fix electrical conduction issues with the heart. And then cardiac catheterization, what we've already referred to as the angiogram, cardiac catheterization. One piece on this, if a patient is going through or has gone through a cardiac catheterization and suddenly gets a rapid or irregular pulse rate after a cardiac catheterization, be concerned, be very concerned, because we are going into that vasculature and disturbing the tissue, opening things up. There's always a potential for damage to the vasculature, which can then lead to bleeding and damage to the heart muscle. Common medical treatments, right? Pharmacology, thrombolytics or fibrinolytics, right? Now, these are not anticoagulants. You all may remember my my little soapbox about blood thinners versus anticoagulants. Blood thinners don't actually thin the blood, right? They slow clot formation. This class of medications, though, the thrombolytics or fibrinolytics, take the clots out. Now, they are not targeted to a clot in a certain place. We give this medication and it breaks down clots everywhere, which can be a problem because we still require clotting to keep us from bleeding out from daily wear and tear, bumps and bruises. So with this, there are some things that for thrombolytic therapy that we really have to be sure of. Um, History of chest pain within the last 6 hours. Right, longer than 6 hours. And if the chest pain has come and gone 6 hours ago, okay, then we don't want to give this scary drug. If it's been ongoing longer than 6 hours, chances are there is some damage that has happened and some necrosis that has happened, and a thrombolytic will go in and break up the clots that are keeping those damaged areas from bleeding out. They have to have ischemia of the heart, which shows up on the EKG and also by chest pain that persists even after giving nitro. Nitroglycerin doesn't just blow things up, right? Nitroglycerin is a vasodilator. So let's say we got a vessel, which is normally like this, but due to some crappy living and a whole lot of McDonald's cheeseburgers, it's got a little narrow spot right here. Okay, all right, you can see that. Right? Got a little narrow spot right here. And something like a clot gets wedged in that, and it has restricted blood flow distal to that spot in the heart. Okay, or in the brain. Okay, we'll get to different CVAs here in a while, but so I've got that. And if I give nitroglycerin, it's a vasodilator. It opens that up, restores blood flow. Life is grand. Well, life is probably not grand. You probably need a coronary catheterization and maybe a stent placed, but for this moment, life is grand. We got some time. If that ischemia, if that lack of blood flow or that severe decrease in blood flow continues after giving the nitroglycerin, okay, it's time to bust clots down. All right, so here's two pieces. History of chest pain in the last 6 hours, ischemia that continues even after the nitroglycerin. Okay, two ticks on the it's okay to get a fibrinolytic or a thrombolytic. Right now, no recent history of surgery or no recent organ biopsy. Recent. Okay? We'll come back to CPR in a minute. A hemorrhagic CVA. There are two types of CVAs. CVA, cerebrovascular accident, stroke, if you will. There's hemorrhagic, where a blood vessel is ruptured and there's bleeding. And there's a thrombotic stroke or an embolic stroke, where something has floated along and blocked off a blood vessel. Okay. So hemorrhagic CVA, bleeding abnormalities anyway. If you're already a bleeder, throwing something that takes out all the clots that have formed, not going to be a good thing. Intracranial neoplasms. So brain tumor, a recent head injury, pregnancy, or an allergy to streptokinase, which is the thrombolytic. Okay. These are all things that would say you can't have this. So hemorrhagic CVA, this makes sense. You got a hemorrhage, your body is trying to stop that hemorrhage, so it's forming a clot. If you've had a hemorrhagic CVA, you want that clot. If it's a thrombotic CVA, you don't want that clot. Easy enough. How do we figure this out? CT of the head. Intracranial neoplasms. We have a tumor in the brain. It's disturbing tissue. It's pushing things out of the way. It can cause a bleed. If it causes a bleed, you want those clots. Right? Recent head injury, same thing, right? Allergy to streptokinase, okay, kind of a duh. Streptokinase is a thrombolytic. If you're allergic to it, you don't want to take it. No recent history of surgery or an organ biopsy because you've got clots holding that together, keeping it from bleeding out on the bed. The last piece, CPR. Well, we'll hit pregnancy last, but CPR. Okay, I've had a heart attack. I got CPR. Now I can't get a thrombolytic? Correct, because CPR is the worst beating most humans will ever take in their entire lives. And the last piece is pregnancy. We have a uterine wall. We have a placenta. The two are attached. This is a really big umbilical cord. The two are attached. They're attached with mechanisms very similar to clot formation. If we have a clot buster, placenta detaches, baby dies, okay, right? But where that is broken down there, now mom can't form clots on that surface where the bleeding has happened, and mom hemorrhages. Bummer day, dude. I think we'll finish this one off right around in here. So common surgical treatments: PTCA, percutaneous through the skin, transluminal into the luminal, into the lumen, luminal. Yeah, okay. Coronary, heart, angio, vessel, plasty, fixing. Right. So with this is where we go in through the femoral artery, thread a wire up through from the femoral artery to the external iliac, to the common iliac, to the abdominal aorta, the thoracic aorta, up over the aortic arch, and into a coronary blood vessel. So the physician is going in and fixing the heart from the crotch. And with this, atherectomies, laser angioplasty. Atherectomy, they go in and take out some of that atherosclerotic, that fatty cholesterol plaque that is blocking off the artery. Go in and atherectomy, take that atherosclerosis out, open up blood flow again. Or with a laser, blasting pieces, or placing a stent, which looks like a very tiny little roll of chicken wire that is placed into the artery where it's narrowed. It's over a balloon. The balloon is inflated, and it pushes that artery open and leaves the wire stent in there to hold it open. Coronary artery bypass grafting for cardiac surgery, also known as a cabbage. This is not what you're making coleslaw out of or eating with your corned beef. CABG, coronary artery bypass graft. We talked about this in first term musculoskeletal, where split the sternum in half, jacked a rib cage open with the medical equivalent of a handyman jack, and redo the plumbing. This can be one up to, I had one patient who was a 6-vessel cabbage. That heart was a mess. Right? Heart valve repair, where, as you are recalling from bio, right, the chambers of the heart and the valves, we can go in and fix those. Now they can go in and fix a heart valve from the crotch. No longer an open heart surgery in some cases. Same thing. They thread a wire up and a catheter in through, put the end of the catheter in the open. This is very simplified. Sounds so easy. It's not. And inflate a balloon, which then forces this new plastic valve out into place, and there's now an artificial valve in place. Can also be xenografts used, or other mechanical valves, but those are placed in an open heart surgery. And then finally, heart transplant, which kind of says it all. Now, think with heart transplant, what is that patient going to be on for the rest of their lives? It's a transplant. Think about it, you'll get it. And we are going to pick up here in the next video, nursing considerations before surgery. With that, I've given you a little bit to think about. And we're going to stop this now. Have a great weekend.